Today we just want to talk a very short video about wearing a harness and suspension syndrome or orthostatic shock. I just want to explain to you what happens. So usually when you're connected from a harness into maybe scaffolding or some type of fall arrest, you're going to be wearing your harness connection point in around the back here to your dorsal D-ring. So what happens then is when you take a fall and you're suspended, the harness starts to apply pressure to your body, particularly up around your femur here up into your groin, across the chest straps, as your body starts to sink into the harness through gravity. So gravity is pulling you towards the ground and the harness is being pulled up, so it tightens around your legs. And this tightening can cause a pressure on your femoral arteries. And the next thing that means, blood's not properly flown into your legs. But whatever blood is in your legs is finding it very hard to return back out of the legs because your feet aren't on the ground and your legs aren't moving, gravity is pulling the blood down into your legs and down into your lower limbs. And because you can't move your legs and there's no pressure, your feet aren't on the ground, well then the pumps that are in the soles of your feet and the pumps that work through your calf muscles contracting, them muscle groups pump blood back up on your venous return up through your legs. So our heart is able to pump blood into the legs, but it doesn't have the power to pump it back up. So you have this muscle contraction. It's like an additional pump that helps blood return. And when the blood can't return, then you get this pooling effect in the legs. So what happens then? So with the pooling effect of blood traveling into your legs very slowly because you have got the pressure on your femoral arteries and not being able to return back out, you start to produce kind of waste products. Now there's no evidence on this, but it's the build-up of potassium and magnesium and some calcium inside your legs. And the thought process was that if you suddenly release someone from these harnesses or release them down too quickly, you got blood return back up into the system, which caused damage to the kidneys, possible failure of the kidneys, and possible arrhythmias in your heart, with potassium and magnesium being contributors to heart rhythm. So they were two of the factors. That's never been actually proven. So there's no real evidence on this. But what there is evidence is that when you start to lose blood into the bottom of your legs, you start to lose blood flow to your brain and you become hypoxic and you may pass out. And if you pass out and you're suspended from your D-ring at the back of your harness and you go unconscious, well then you fall forward and your chin will drop to your chest, and that may compromise your ability to breathe or your airway, so that can become a problem. So, and the other thing that may become a problem is the chest strap may become tight around your chest and you cannot breathe properly. So they're all little medical issues that may occur when you're suspended for a period of time. Now you're talking about quite a while. We know from a previous video that you can put on a tourniquet and have it on for up to 4 hours. So suspended in one of these things, you're going to have to be suspended for quite a while to have any real adverse reactions, but you may pass out. So it's essential that you have a rescue plan in place when guys are working at heights, that you've risk assessed everything and you have all the proper measures in place, that guys know how to use their harnesses properly, and that you have the likes of an ICAR system or a roll gliss system, that you are able to make contact with the patient, raise them up high enough to be able to release their anchor point and then lower them to the ground. The theory was that when you got patients to the ground with this process of not having all the blood flowing back into their body too quick, that you sat them in an elevated position. But the current standing on that is that the patient is put down in a recovery position. You check their ABCs. Once their ABCs are fine, you put them into a recovery position and then you get them transported to the hospital. Okay, thanks guys.